the science behind the peer influence. So yeah, he's gonna be sharing his research around the vaccine, and then we'll be finishing the town hall with a panel discussion. So yeah, this is so exciting, you guys. Thank you for being here. So yeah, I think we can start introducing our youth board. So I can go first, and we also have a icebreaker question. So you can just say your name, your pronouns, any agency affiliation, and then the question is, what do you feel, well, it's March, so St. Patrick's Day. So instead, what do you feel grateful for? It's what do you feel lucky for? So I'll go first. My name is Travis. I work with the LA LGBT Center, and I work with LACEYH. And yeah, so my pronouns are he, him, his. And what I am, what I'm lucky for is really just my friends. My friends have really been there for me during this year. And yeah, they're just my family, and I love them. And yeah, so, and also youth board, if you're here, please put your camera on so you can see your beautiful face. But yeah, whoever wants to go next can go. I see Sage, I see Hunter, I see Tony. So whoever wants to jump in, feel free.
I'll jump in. Good afternoon, everyone. Happy Friday. I'm so happy to be here. And I'm so grateful that we are having this town hall on a much needed topic. My name is Sage Johnson, pronoun she, they. And what I am grateful for is my chosen family. I love y'all so much. All right, I'll shoot it over to Tony.
I'm not sure where Tony is right now. I'll message him offline, but does someone else want to go?
I'll go. My name is Alex Furtado. I am a community ambassador at SPY, but also part of the Youth Expert Board. I started out working with the Hollywood Homeless Youth Partnership, and then I got invited by wonderful Robin, and now I am just here with LACEYH working with the Youth Expert Board, and I feel very lucky to just be able to have the platform that I have and to use the voice that I can to do the things I'm doing. Thank you for having me, and thank you everyone for coming.
Who's next? Hunter?
Yeah, I can go. Hi, my name is Hunter. My pronouns are he, him, his. I'm with the LA LGBT Center as well as the LACEYH Youth Expert Board. And what I feel lucky for is this is cheesy, but my partner. He's just been there for me. And that's it. Whoever wants to go next, go next.
I think Melly.
Hi, my name is Melly. My pronouns are she and her. And I guess what I'm grateful for is that my birthday is on the 19th. And so another year. I'm not happy that it's another year in COVID because this is my second birthday in COVID, but I am grateful that I have another year.
Happy early
and
birthday.
I'm part of the LACEYH steering committee.
Awesome, Melly. It's so good to see your face. I'll go. Robin, she, hers. I coordinate LACEYH with LACEYH, and I feel really lucky to work with all this group right here and to be able to put on this town hall with y'all today. And Laura, do you want to go?
Hi, everyone. My name is Laura Onashkara. My pronouns are she, her, hers. Robin took mine. Feeling really lucky to be here with everyone. I feel really lucky to be in partnership with all of our expert board members and all of the LACEYH coalition. And excited for this today. Julia, do you want to go next?
Sure. My name is Julia Alessandra, pronouns she, her, hers. I'm an MSW intern this year with LACEYH, and I feel very lucky that my midterms are almost over. Nikki, do you want to go?
Hi, everyone. My name is Nikki, pronoun she, her. I'm also an MSW intern with LensCo, like Julia. Today, I feel really lucky to be surrounded by all of you and having these very important conversations.
Awesome. Everyone get a chance to introduce themselves on camera? I think so. So yeah, the next part of this town hall is our slideshows that we want to present to you guys. So I think Laura is going to be pulling that up on share screen. Thank you, Robin.
When you say the word peer, equal, or like somebody who's my age, or somebody who shares like similar experiences, or a similar life like mine.
Peer means someone in the same age range as me. So anyone who's, I don't know. I guess if I was a student, it would be like I'm a freshman, then all my peers are like freshmen, I guess.
I think it's important to have peers, just because it's important to have someone who is kind of in the same ground level as you, at the same like understanding. I think it goes a long way.
I think for me, talking to other peers that work at other service providers, so just to see what they're doing or how they're dealing with everything going on, and kind of giving that kind of support. Be like, there was a time, I forget what it was, but it was like, one it wasn't Spy, it was the one on Hollywood Boulevard. My friend's place was offering resources, but I didn't know about them until, somebody, a youth that worked there, reached out to me. So he was like, hey, there's this things going on for youth. Would you like to participate? So that I feel like it's kind of good, because often, most of the time when we work at service providers, we don't really become friends with some of the staff there that aren't youth, or that aren't necessarily have been through what we've been through. So it's like you do start connecting, and it's also kind of like it's a way for you to start building a social life again, because I think when I was going through homelessness, I didn't, having a social life didn't wasn't part of my schedule. But when I started working again and meeting other peer navigators, or other peers that were working in the system, then we started hanging out. So that helped me build a support system of people who knew what I was going through, but also were working exactly with what I was going through. So I thought that was, that was really good for me.
Other groups that I think have helped me, like during this time too. I think also, I mean, it's definitely different for me and like other people in this space who work for like service providers, right? Because like we definitely have more conversations about like vaccines and COVID and stuff like that. But like also like living with other people, like living at like a transitional living space at the Dream Center in Echo Park. Like, I live with other people who are like former foster care. So it's not just me by myself. So like being able to have people around, I guess maybe more than other people, because like a lot of people have been like quarantining and alone, and that could be pretty lonely. So I know, having other people around, and even if it's not a conversation about the vaccine or COVID or quarantining, it's still somebody that's not just me.
I usually just didn't want to answer the question, just because I feel like I have an unpopular opinion, because like I just personally don't really feel like my peers really did anything for me during this time. I feel like people have just been like kind of just like minding their own business, and just worrying about what's best for them and their loved ones, which like I'm not mad about that at all. Like that's great. It's good that people are trying to focus on themselves and stuff. It's good. It's good to self-invest and all that stuff.
I definitely think it's harder during this time to like maintain those relationships with peers too, you know, like definitely not being able to like see people in person, like call them or text them and just like, hey, like let's get something to eat, or you know, like when are you off work, or stuff like that. It's definitely harder to kind of like keep a constant form of like texting with somebody, because that takes effort, and a lot of people don't really have effort during this time. You know, a lot of people are trying to stay as strong as possible during this time for themselves. So definitely like maintaining relationships with peers during this time is also like pretty difficult.
I usually trust information when I hear it directly from a source. So say like if I hear it from like a close family member or friend, I'll probably trust the information a lot better than like hearing it from someone that I don't really know, or like that hasn't had like their own personal experience with it.
I trust the information that comes from my job because I feel like my job wouldn't tell me something because they wouldn't want to be liable for something that happened to me. So like, you know, I'm sure they do their research, but not only that, you know, like just like different health organizations in the community that we're connected to. So like the Venice Family Clinic is also a great resource. Like when I went to get my vaccine, you know, they were telling me about it, or like they gave me a flyer about it, or if I had questions, I'd ask about it. You know, I don't really like tuning into the news because I feel like there are a lot of different like news channels, and which means there's a lot of different research and a lot of different sources. But DPH and like the Centers for Disease and Control are pretty official, so I trust those.
For me, I think the first person that I trust is my sister because she's a family doctor. So I think I trust her more because she's working with patients and whatnot. But I'm also surrounded by a lot of friends who are nurses or frontline workers. So I think hearing their opinions and what they're saying, for me, I trust that. And like Alex as well, I don't really trust the news, but I do. I still watch it. Like I will watch all three syndicated channels to see all three different opinions, and from those three opinions, I just I gather what I need to, because at the end of the day, you still have to find out what the government is doing or what they're trying to implement. Like, I mean, I get it. Some websites will post something coming out of the White House or something, but I think it's also good to kind of watch different news sources and see what all see different newses with different beliefs, what they're all saying regarding COVID, to see if they're reporting the same thing, if they're not reporting the same thing,
I think it's all very funny too how like, you know, like the news is supposed to be something we trust, but hardly anyone trusts the news.
I think I think it's important to watch the news. But I also think, you know, you have to be careful not to like, get, at least for me, because I get anxiety really easily. And I feel like some news channels like really, they like over sensationalize things. And so they make things like a lot scarier than they really are. And I'm not saying that COVID is not a scary thing, because it definitely is a scary thing, and people should be safe and be cautious. But like for someone like me who has like a lot of anxiety, it's easy to like take that information and like just like start to have like an anxiety attack, because like you don't really know what's going to happen, and it's just like really scary seeing all these things, especially when it's like local news and it's like in places where you like live. And so that's why I say like it is really important to watch news so you are aware of like what's going on in your neighborhood and locally. But just for me personally, I do it like with moderation, just because like me personally, I have anxiety, so sometimes it like stresses me out.
seeing my family members get it, and also like every other healthcare person that I know that got it, was just like an automatic, not like an automatic yes for me, but it was like, if the people I love and trust are getting it, then I should be getting it too. But if somebody that I knew that worked in a hospital didn't get it, then yeah, I would. I mean, I'm still questioning a lot of the things, because you hear one information about, oh, this is good against the UK virus, but then there's a South African strain which, it might just be, it might not be, if you get it, you may not be as sick in hospital sick, but you might still get it. Or, hearing now that Johnson & Johnson got approved for a one vaccine. So it's like, okay, you have, Moderna and Pfizer offering two vaccines, but now Johnson & Johnson is offering, one vaccine is enough. So it's like, there is a lot of question, and it is good to question because this thing just came out, very recent. But for me, people are already taking it, and they seem fine.
For me, it was like very simple. Like I've already got my second dose, so that kind of factor of like, if I'm going to make the decision, too late for that. But like it was very simple for me actually. It was just like, I think back to all the vaccines that I've had in my life, right? Like since I was a kid, right? And I was like, well, how sick did I get when I got those vaccines? Okay, like I really didn't get that sick or whatever, even though this is a new thing. And then, the other two factors where like is there like fear mongering going on, is there like a lot of people trying to create anxiety and fear, and are people stressed out themselves? Yeah, so like of course people are going to express their fears more than normal. So I was like, okay, that's happening, so you got to take that into consideration, that people are expressing their fears because they're scared. It's killed 500,000 people. And then third was like, if I die, I die. Like what's like what's the like let's see what's gonna happen. Let's see what the worst possible outcome is. You know what I mean? And to be honest, the worst possible outcome was just like a sore arm. And the time I got the second shot, I didn't nothing happened. So it was really just the first shot, and that was it. And like that was because when you like make things complicated, I feel like it makes everything so much worse. You know what I mean? Like you start overthinking, you start getting in your head, you're gonna psych yourself out. So you just keep it simple and you just make a decision and go a direction, and that's it.
I mean, I don't really have much to say. Like, I just got my first dose yesterday. And I am feeling like side effects, but like, I mostly like made the decision like for at first I wasn't like going to take it right away, but then I ultimately decided to do it for personal reasons. Like my uncle and possibly my grandma died from COVID, and so I just think of them when I made the decision.
I would like people to know that it's okay to question things and doubt things because, I keep meeting a lot of people who are like, it's not that I don't trust the vaccines, it's just everyone just assumes that, well, I'm automatically supposed to take it, or like, it's just like, my friend was like, just because, I don't know, it's just the idea of, I want people to know, like, it is okay to question this thing, and it is okay maybe not to want it now, or maybe down the line, 3 months, 4 months from now, when you feel like you need it. You don't have to be in a rush to get it now.
All right. So that was a slideshow. I want to initially thank all the youth members who was willing to record their opinions and experiences around the vaccination. And also shout out to Meredith, who provided us with those illustrations, and Nikki and the rest of the team who put all the pieces together. I do want to mention people who are in the chat box who are introducing themselves. Make sure you select panelists and attendees, because I believe some of your messages are just going to the panelists and no one else is seeing them. So yeah, if you would like to reintroduce yourself and make sure it's visible to everybody, that'd be great. But yeah, if there's any like comments that the youth board would like to add to the slide, definitely speak now. But if not, I'll hand it over to Laura, who will introduce Dr. Rice.
Thanks, Travis. Hi, everyone. I just want to say thank you again for being here and for listening into our conversation that we had with the expert board member. I'm really excited to invite Dr. Rice to be with us today. He's been a longtime collaborator with LACEYH, and today he's going to do a presentation on the science behind peer influence. So I'll go ahead and let Eric go, and he'll be able to share his screen with his slides.
Hey everybody, I'm Eric Rice, and I just saw that my rename he, his. I use he and his pronouns, and I'm very happy to be here and being able to be a part of this conversation. I think I was really moved by what I just heard with the slideshow, hearing young people talk about their experiences with peers and the importance of peers and family and how that impacts your thinking. I think that this is really very much in line with what I'm going to share with you all this morning. And so, hey, Laura, remind me, I've got 10 minutes.
Yes.
Okay, here we go. Peer influence in 10 minutes or less. We'll do my best here. So let me just, oh wait, did I get this is the wrong thing. Sorry, I'm an old person, and so therefore I'm dumb about things like technology sometimes, and so I'm pulling up the wrong thing. So let me just get the right thing, and we will be good to go. I thought I had it open, but of course I closed it because I got distracted listening to all of you talk and stopped worrying about what I was going to say next and just was getting into what you all were saying, which was really exciting for me. Okay, now I've got it. Now I should be able to make this happen. Okay. There we go. All right. I'll move this out of the way, and then we'll go to slideshow and play from the start. Okay, so what I'm going to talk about is peer influence and some of the work that I've been involved in for the past several years, really, where we've tried to harness peer influence in the community of youth experiencing homelessness to try to encourage HIV prevention behaviors and testing. And what's really exciting about this for me is that both Robin and Laura were key parts of this work that I did over the last few years, and I certainly couldn't have done any of it without either of them. So I'm honored to talk here. So this is some things that which some of you may know and some of you may not know, but just to kind of give you a little bit of a context about HIV, which was really the public health crisis that we were trying to deal with at the time with this study, was that in LA, there are a lot of youth who are experiencing homelessness each night. 2020 said there's almost 5,000. What you may not be as aware of is the fact that there are a lot of racial, ethnic, and sexual orientation disparities with respect to HIV risk. So, for example, we have unfortunately low numbers of folks who have been tested in the past 6 months for HIV in the African American and Latinx, in the Black Latinx community. We also have a lot of young men that have sex with men who are in the part of the Black community who've also not been tested recently. So there's it is not maybe the newsworthy problem that COVID is, but it certainly is one. So networks can potentially be mobilized to help us deal with public health crises. And one of the things that, from what we were hearing from the interviews shared just a few minutes ago, was that oftentimes people are looking to different sources for their information, right? Not everybody trusts the news. There's a lot of good reasons for that. A lot of people trust their friends and their family much more so. Some people trust the places where they work or official health sites. And what we wanted to do in this particular study was we wanted to make sure that, or this research was to try to leverage the kinds of conversations that young people might be having with each other. So another thing that's kind of interesting to think about is, who do young people talk to? So if all of these dots represent young people and the lines represent connections between young people, we had this one study where what we found out was that some people are acquaintances that people talk to. Those are the gray lines. Some people are friends. Those are the green lines. So mostly we talk to our friends. And then some people are our sex partners. Those are the red lines. So this is what a conversation network amongst youth experiencing homelessness might look like if you drew it out as a graphic. And then this is what it looks like when we asked the same group of young people who they talked to about condoms and using condoms. So you can see that suddenly there's, a lot of those green lines went away. A lot of the red lines went away. A lot of the gray lines went away. And so what we are saying with this is that, there are some, young people that are talking about sexual health with one another, but not enough. And we really wanted to try to mobilize a lot more of this. So what we were doing was we were working on what we refer to as a peer leader model or a peer advocacy model. And the basic concept behind it is that we would work with a small number of young people who we'll call peer leaders, who we would then train to know a lot of facts and factual information about HIV, and how you can get HIV, how you can prevent HIV, the importance of getting tested. And then we asked those young people to go out and talk to their friends about what they were, what they had learned, so that just like what we were talking about, earlier in those conversations, we could really spread information that was accurate within the community, when people are maybe not trusting of other sources. And so what we did with this was, and here's a picture of Laura from back in the day. We actually, had a couple of MSW at the time. This is when Laura was a student. So she was an MSW intern for me. And she was working with a group of young people at the time who were actually being trained to go out and do this work and to influence their peers in positive ways. And so what we did with this, the way what the model actually looked like, was that we had a one sort of a half day training, and Robin is the person who really was the architect of the designing this part of the project. We did a half day training where we taught people about HIV and STIs, but we also taught them a lot about communication skills, leadership, and about self-care and some other things that are really important if you're going to go out and do this kind of work. And then we also would meet with those young people who we trained to be our peer advocates once a week for 7 weeks afterwards, to really work with them around what was happening, what problems were they running into, to help them brainstorm how to keep up with their work and to support them. And what we really encouraged people to do was talk to their friends, a little bit on social media, but mostly face to face, which I think, as we're thinking about COVID, and the realities of COVID, this might be a little bit different if we were to apply these ideas to COVID. But still, the idea is that rather than just talking to random strangers who might not value your opinion, if you talk to people who who trust you, those are the people who you're really going to be able to influence in a positive way. So we did this work with Safe Place for Youth, My Friend's Place, and the LA LGBT Center. And it took us about 2 years to do all of this work. And we actually involved a total of 714 youth in this study. And we had we actually had 3 different arms of this study. I won't get into this a lot, but basically we tried, one method for picking out our peer leaders was picking the people who had the most connections in the community, popularity. And another one was we used a computer algorithm that was designed by some computer science PhD students that we worked with, who where they used artificial intelligence to try to smartly pick with a computer program the people who would potentially be the ones best able to disseminate this information. But what I'll share with you here is really just kind of how excited we were about how well this worked, right? So if you look at, whoops, I don't know why that jumped back. If you look here, what you can see is that the observation, which is just, this is basically just people who we interviewed over time, that were just receiving normal services at the drop-in centers, versus the times when we went in and we tried to mobilize people to influence their friends. And what you can see here is that the number of people who had vaginal sex without a condom in both the yellow bar, which was the popularity version, and in the AI bar, which is the red version, they both of them, the rates go down. And then also when we're talking about anal sex without a condom, you see the same thing. That we see improvements in both of the groups, where we had young people out there who were leveraging their relationships with their friends to try to help their community, be healthier. And one last thing I'll show you is some of the results about HIV testing. So HIV testing is another thing that we're really interested in. And what this is really just showing is that, when we first met people, there was, about a quarter to a third of folks who needed to get an HIV test. And that what we found was that by the end of our study, we were actually able to get a lot of people to get HIV tests, especially the people that were in our artificial intelligence arm. And so I think maybe what I'll do is I'll take some questions, Laura, because I wasn't quite sure how much I wanted to lecture so much as share the excitement about this. So I think the one last thing that I'll say is that I really believe, and I think that Robin and Laura would agree with this, that COVID and the idea about vaccination and is it a good idea, is it a bad idea, the information that we need to know about COVID in order to, and the vaccines in order to make that decision, getting out information to people is a challenge. And one thing that we've learned over time while we're working with young people who experience homelessness is that young people who experience homelessness are very good at taking care of one another and helping one another when they're when they're in need. And what we also see is that they're very good about connecting to their friends in important ways, and that they did this around HIV prevention. We think that it seems like a really reasonable idea that this could help with COVID vaccine information as well. So I guess I'll take a couple of questions if there are any. Maybe Robin or Laura, you can help me figure out how to even make that happen. I suppose I should stop sharing my screen, right?
Yeah, thank you. I mean, this is so great to see this old work, and we asked Eric to come and present because of how relevant all this stuff is to the current ongoing pandemic, and of course to the next steps and next stages of rolling out vaccines and other types of health promotion behaviors. So I'm curious, like, what the young people or what our youth board, if you all have any questions or thoughts on peer influence and peer networks. I mean, some of what came up in the pre-recorded stuff, but any thoughts? You all are a smart bunch.
I'll look at the chat box and see if there's anybody else who's...
Stage, you don't need to raise your hand, just go for it.
Thank you, Dr. Rice, for the presentation. My question is, what have you seen in terms of willingness with young people to get vaccinated versus how folks were getting treated for HIV back then?
That's a really good question. So, when we were doing this work in 2016, 2017, 2018, 2019 is kind of when we wrapped it. HIV had been around for like 30 years. And so people knew that, there was no cure for HIV for the most part. And people knew that there were some things that, you could do to prevent the spread of HIV. And a lot of it is just was working with young people to remind them about the importance of protecting yourself about HIV. I think now everybody's really afraid of COVID, but they don't necessarily know how safe it is to get these vaccines. And so from what I understand from some research that Robin did recently is that young people experiencing homelessness, at least over the summer when they're asked, would you get a vaccine if one became available? So this is long before they were available. I think it was about 40% or so said that they wouldn't, that they were suspect of it. And I just saw some data that another friend of mine named Benjamin Henwood, who's another professor at USC, he's done some work with adults who are experiencing homelessness in the Venice Clinic. And one of the things that they found was that about half of the people who are who've been offered a vaccine to date, who are homeless adults, have turned it down because they're concerned about it. So it's, there's definitely, I think, a lot of people who are worried about this. And so, there's not really a comparable thing with HIV in terms of like, do you want a vaccine? Because there is no such thing as a vaccine for HIV, but there is this pill that you can take that's called PrEP, and that pill, there's also some concern that people have about side effects, and so not everybody who is eligible to take those pills wants to take them. So it is part of what happens with public health issues, is that people don't know what information to trust. They don't know what's going to happen to them and their bodies, when they do this, and so that can be very scary. So that's a great question. Thank you, Sage.
I'll add a little bit to that too. And I think one of the things and Laura, you can pop in, when we're doing the trainings, the way these trainings were designed to just promote, like be able to provide the information and education, right? So I think like the same thing with vaccines, right? Is making sure that young people have the confidence and ability to access like the information to make the best decisions for themselves, for their own health, right? And so there's so much misinformation or incomplete information, or just like being able to, like such an important part that I found with vaccine stuff is being able to talk through like questions that you have like with peers, right? Versus just like getting berated with like a website, right? And a bunch of information, just gonna be like, well, I don't know what that means or how to feel about that. How do you feel about it? Is such an important part of the conversation, just making sure that we're creating safe and accessible spaces for that.
Yeah, and I think one thing that I dislike about the term, peer influence, right, is that it almost has it suggests that we're trying to convince people to do something, right? And I think that more we know that people are influential to their friends, and what we would like them to be influential about is sharing information so that people can make educated decisions for themselves about, what they want to do. And I think, all of the stuff in the slideshow made it very clear that there's a lot of confusion and misinformation, and some people feel more connected to information that they trust than others, and all of that makes a lot of sense to me.
Yeah. We had one question in the chat. Someone asked about demographic data and comparing BIPOC youth to their white peers when talking about concerns of the vaccine. Maybe that's something we can talk on the panel. The panelists can talk about that, their on the ground experience. In the research we did, we haven't found any differences amongst youth experiencing homelessness. So, but for HIV testing, were there any differences across the
Not really. I mean, it was, and in terms of sort of the influence for the model, the peers were just as good at sort of sharing information about condoms and HIV testing, regardless of what race or cultural group or sexual orientation group or gender identity group they belonged to. It was really, but I think that when we designed that study and that intervention, we're trying to be very thoughtful about being inclusive of people of different, we've got different identities, to make sure that it was good for for everybody. That doesn't mean it's going to work for everybody, though. So I mean, it was nice that that people felt engaged. Are there any other questions? If not, well, I mean, it's always a pleasure to speak at a meeting like this, and to get to hear the voices of young people talk about issues that are, so, relevant to my own work, but also just to the world. So thank you very much for taking asking me to be here, and I'm looking forward to hearing the rest of the conversation.
Hey, thanks for coming.
If I can ask a question real quick. Sorry.
Yeah, go ahead.
I guess my question is, in terms of talking about HIV, is that, HIV and AIDS have been an ongoing thing since the 80s. And, all this research has gone into finding, the vaccines to cure, prevention, methods of prevention. But then here we have COVID, another disease, whatever virus that, that's affecting a lot of people. And now the government has invested so much money into, getting a vaccine so quick. So I guess for me, my anger was out of, so have they not been investing enough money to get, or do they not just want to get a vaccine for HIV AIDS, or is there not enough funding, or what's the reason for us not having, something like a vaccine for HIV now, but under a year we already have a vaccine for
Yeah,
COVID?
it's actually a very scientifically kind of complicated answer, but the short version of it is that COVID-19 is a standard virus, and there's a type of virus called a retrovirus, which is what HIV is, and HIV gets into your cellular makeup in a way that normal viruses don't, and so they're much more difficult to create vaccines for, and they have yet to figure out how to make a vaccine for it, even though they've been trying and funding it really aggressively for a very, very, very long time. So part of it is that the scientific community is more armed for this kind of virus than they were for the HIV virus, which was a really kind of threw the scientific community for a loop, and still is to this day. But I understand your frustration that, wow, we can get this in, under a year, and it's, 35, 40 years later, and we're still, people are still dying from HIV. And, I'm with you on that one. I mean, it's really frustrating.
Sage, did you have one last thing?
Yes, I have one last question for Dr. Rice. Dr. Rice, what is one way that peers can be well informed if they're not tied to any particular agency or educational institution?
Oh man, that's a good thought. I mean, I think you can use your Google searches to look up information, but but I think that there's a couple of places that have accurate information. So one of them is the CDC. So when you go to the Centers for Disease Control, those are the best. That's the most accurate information, and they usually try to provide the information in a variety of different ways that are usually pretty accessible for most people. And I think that, and then the other thing is to try to talk to somebody who's either like a caseworker or a physician or something like this. But I know that some folks are disconnected from that. So I think that use the internet to the best of your ability and try to find things that are legit sources. And definitely the CDC is the most legit source for public health information, and that's really the best place to find that stuff. It's not the most exciting website in the world, I'll tell you that, but it's got the information there.
Well, thank you so much for coming, Eric, today. This was great to have you back at LACEYH in a LACEYH event, and I'm glad the board was able to ask you questions directly. And I'm sure everyone will share your information in the slides and the follow-up emails for folks. So thanks. I'm gonna move you back to attendees. Have a good rest of your afternoon. Bye. All right, so we are doing a little bit of a brief of a break. And Travis, you want to introduce the break? I'm looking for.
Yes, so we're gonna take a short break, get ready for the panel, and then we'll come back and have our panelists start.
Hey, Travis, can I add something real quick?
Yeah, of course, Tony. Go for
While
it.
we're on a break, if you have time to go over on Twitter and search the hashtag LACEYH Townhall, if you wanted to join the conversation and ask and answer some of the questions that were discussed today, that would be great and much appreciated. Thank you.
Yes. So for the break that we're going to do a little brief break. Daryl, are you there? Yay. And why don't you introduce, we're having a little brief art break.
Perfect, yes. So I'm Darielle, pronoun she, her, hers, and I'm from My Friend's Place. I work as a clinical social worker or housing case manager, whichever one. But I'm going to talk a little bit more about the creative arts that we have at My Friend's Place. I guess we're going to look at the zine, right, Robin? Perfect.
Right now.
So just a little bit about our zine, which is called Popcorn. It's a place for youth to display their art while also being able to express their voice or use their voice. And it's in our 18th volume, and we publish it every month. And we've had a lot of youth who are really interested in promoting their work in the zine, and it is something that we've been doing, but we have gone digital because of COVID. And so now it's a digital framework that we have now. As part of this, we learned that youth are really interested in still submitting their work, even though we are not fully open. And we have kind of been really piloting our workshops and the way in which we can have youth show up and still provide that resource for them. In addition to the zine, though, which is part of our transformative education department, which is also known as TP, we also have the Corner Collective, which is a space for youth to sell their art, and 80% of those proceeds go directly to youth. We've created an Etsy shop because of COVID, now that everything's online. So if you want to check it out, feel free to do that. But that's our zine, or that's popcorn for you.
So great. I can't believe it's an 18th volume.
Yeah. We've had a lot of people that have been interested. And we also have had a couple of times we've had staff submit some of their artwork just to create a conversation between youth and staff, which has been really amazing. But yeah, it's in its 18th, so it's great.
This is so cool. So this right now is on a link that people can view publicly, but then we'll also share the Etsy store and other things for folks. Is there anything else? Yeah, Youth Board, do you have any thoughts or questions?
I love it. I definitely want to get a copy of it for sure.
So great. Crabs in a bucket.
Yeah, some great pieces there. Yeah, we can definitely share for sure.
Awesome. I'm gonna scroll.
Yeah, I put the link to it on the chat. I love that when you flip, you can hear the flipping of the pages. So you can find it there on the link, and we can also send an email at the end of the event and just remind folks that they can check it out.
I have a last question. Where did the name Popcorn come from? I love it.
That's such a great question, Robin. I'm not the one to answer that. Probably their manager will be able to, but I think it's such a creative way to come up with a name for a zine. But yeah.
It's so great. All right, amazing. All right. So I think we're gonna move into, and you'll be on our next panel as well.
Yes. Should we start?
Yeah, I think we're getting all the panelists up on camera. Is my team working through that? Why don't we, Sage, do you want to start introducing the panel?
Don't mind if I do. Hey everyone, so we're going to move into the panel discussion portion of the town hall. My name is Sage. I will be your moderator for this session. And I am a youth expert board member, and something that inspires my advocacy is the need to do better and be better. And my favorite way to relax is Mad Libs. Fun fact for everybody. So I would like to introduce our panelists. We have Darielle Crawford, a clinical social worker from My Friend's Place. We have Jeffrey Richardson from Covenant House. And then we have Sung Jae Lee from UCLA, as well as Hunter Pixel, who is also another youth expert board member. Thank you all for being here today.
And Sage, Melly is also going to be a part of the panel today as well.
Okay, come on in, the more the merrier. And now we also have Melly coming in to join in on the panel discussion as well. Melly is also another youth expert board member. Thank you. So everyone, when you come in and I introduce you, please come in, say what your pronouns are, and also actually I did that for you. So I just want to dive deep into the questions now. Okay, to start for the first question, what are you hearing so far and what are the challenges? The what is being surrounded by COVID and the lockdown and also vaccinations. So I would like to start with Dr. Jae Lee, please.
So good afternoon, everyone. My name is Jae Lee, he, him, and his. And first off, I feel really lucky to be spending the afternoon with all of you. And it's been such an inspiring session so far. So I appreciate all of you, and I feel really lucky. And as a full disclosure, I am an epidemiologist at UCLA, but I think I get inspired by interacting with community-based agencies and youth with lived experiences. And I think in terms of um, the question about what I'm hearing right now, I think a lot of it has been covered already. And I think there's an important necessity to link the information that we have in the scientific community, but how do we bridge the information that we have to the communities that are impacted by COVID-19 pandemic? And for homeless youth and agencies that serve homeless youth, I think the very important thing is, I think messaging is important, how to dispel misinformation, but also how to prepare the right information to the messenger that are appropriate. So I would say I myself as an academic researcher is not going to be an appropriate person to convince a young person to get vaccinated. What is important is for me to engage with peer leaders like yourself and others that youth trust to provide the relevant information so that that information can be digested and digested and processed by young people. So I can get started with that.
Thank you, Doctor. I would like to follow up the question with Darielle. What are some of the things that you are hearing, or what are some of the challenges that you have been?
Yeah, thank you so much, Sage. I think for me as a case manager, I have a caseload, of course, but I interact with youth on a day-to-day, and there has been conversations since the start of the pandemic about COVID, and a lot of distrust around what's been happening, how it started, a lot of distrust around the government, and I think the challenges has been, really trying to figure out how can we create a system that support people who have been traumatized by systems, who have been underrepresented, like in our medical system, who are not seen and heard often, right? And I think that what has come out of that so far is really trying to roll with that resistance and roll with youth who don't feel comfortable, which is completely fine. And I think another thing too, like now that the vaccinations are starting to roll out, it will be curious. I would be curious to see how those conversations will shift or change now that people have access to it, especially our in-house community, and what that will look like. So those are the things that really have been happening or coming up for me in my work.
Thank you. And I'd like to follow that up with, how do you have a productive conversation with the young people who are hesitant?
Is that,
Sage, I'm
is
sorry,
that,
is that for me?
is that for?
Yes, that's for Dario.
Yeah. I think really just engage in that active listening and acknowledging and validating those feelings. I mean, especially with our youth, our Black youth, there's just a lot of trauma, a lot of historical trauma associated with vaccinations and medical care. And I think as a person who identifies as Black, I kind of know what that feels like. And so being able to resonate in that way and connect with them in that way is really important. And I think rolling with the resistance is part of that work, or working with someone who's hesitant, and just really, really wholeheartedly understanding that and creating space for them to express that, because that often doesn't happen.
Sage, I don't know. I don't know what the format is, but I just wanted to echo what Darielle was saying. I couldn't agree more. And I think we really need to understand and appreciate, the world in which homeless young people live. And, I think in terms of vaccine hesitancy, Dr. Rice, mentioned that it is real. And vaccine hesitancy is not only for homeless youth, but also for healthcare workers. So I think, Robin's point about having an opportunity like today's forum to have an honest conversation about, dispelling some of these misinformation, I think is critical. And I think the challenge is, how do we work with homeless youth to kind of think about what really motivates them and come up with a better narrative instead of, a scientific narrative about what, how the vaccine actually works. But, if we provide information about some context, for example, all the vaccine trials that we've done so far, we know for a fact that participants died from the trial. So that might be much more important and relevant than, thinking about how to explain what mRNA vaccine works and how adenovirus vaccine works. So I think it is important to respect and understand the lived experiences around healthcare access of, marginalized communities and, BIPOC communities. And I think we need to respect that and understand, how they're viewing the world in terms of care access and the level of, trauma that they faced.
Thank you, Dr. J. Lee. Jeffrey, would you like to add to the conversation of how do you have a productive conversation with people that are hesitant?
Yeah, this is a timely question for me. We just had Walgreens out yesterday, who's local here in Hollywood, and they brought 100 vials of the new Johnson and Johnson vaccine, and it was our job to educate the youth and inform them about the benefits of getting the vaccine. And of course, as a steward of the agency and wanting our small community here at the Covenant House to protect, their own health and the health of our agency and staff, of course I was promoting it, right? But we had a little coffee and donut session yesterday morning, and it was very fun, informative, and interesting just to hear the differing opinions. We had people who were concerned about being injected with microchips that would follow them. We had some that were concerned, had generational concerns like, I need to call my mom, or let me talk to my uncle about this. I don't know about this. And I think sometimes, just exercising their choice, sometimes it's just no, right? It's kind of like right now it's a no. And I have to be okay with that, right? Because it doesn't mean that no is a total no. It's just like right now, I'm gonna watch some of my peers that took it and see how they respond. Watch some of the staff who took it. I was really impressed. Initially, when we started to pass out flyers and let the youth know that Walgreens would be here, I was very pessimistic that we wouldn't get many youth to get the vaccine, and we were able to get 28 vaccinated yesterday. So to me, that was a phenomenal number. We had several that made the last minute decision to do it. And I'm super optimistic that after they're able to share those experiences or their experience with taking the vaccine, and then over some time, they will be able to, give information to their peers. I think that's our most valuable tool is that peer-to-peer interaction and conversation that's going to help us, maybe get more people vaccinated.
Thank you, Jeffrey. And if I didn't introduce you before, this is Jeffrey Richardson from Covenant House in Hollywood. To the next question, how do we build supportive networks for youth? Hunter, I'm going to pass this to you.
Hey, building supportive networks for youth. First, I think importantly is just getting a contact person. I feel like not necessarily a case manager, but just to have a point person when it comes to setting up the youth for their appointment and their follow-up appointment. Because as someone who has gotten the vaccine, just the first dose. It was really hard to navigate. It was hard to make the appointment. And when I got there, I didn't know that I had to wait an additional 2 hours past my appointment. And so just like being upfront with that in the future overall, I think would be a great start.
Thank you. Melly, I'm going to ask you the same question. How do we build supportive networks for youth?
Yeah, give me a second because I did write all my answers down so I can concentrate better.
Take your time.
I guess like for me personally, I stay in like close contact with a lot of like people who work in the industry. So that's how I do it. But for other youth, I would say through social media and through like people that they trust, like at different like youth centers and things of that sort.
Good job. Or
I also think that like making chats is also a really great way to like reach out to a lot of different groups and a lot of different variety of people all in one place.
Thank you, Melly. I appreciate that. And Melly, I want to ask, what have you been hearing so far? And what are some of the challenges that youth may have came to you and expressed?
I've heard a lot. I've heard like definitely a lot of negative a lot of youth have said a lot of negative things about what's been going on. People are scared of getting the vaccines because they don't want to have like allergic reactions, or they don't a lot of people have like conspiracy theories that they don't want anything to happen to them. They said they're like, I've definitely heard the microchip thing about like the government using the vaccine to track people down. So I've heard a lot of negative, but I've also heard a lot of positive because like I said, I keep in communication with a lot of people who work in the industry. So I have friends who work in Project Room Key right now, and they're getting the vaccine. So I've heard like on a personal level, like a lot of positives, them saying that like, yeah, my arm was sore at first, but overall it was just like a regular vaccine. I didn't have any negative effects. Everything went pretty well. And they suggest that, a lot more people get the vaccine. So, but it's mostly people who are in the industry that I've been hearing a lot of positives from. And the negatives I hear from people who are not really involved in the industry because they're not getting enough information. So, they kind of like make they have their own opinions based on, their frame of reference. But as far as actually getting the vaccine, I have heard that it's a little tedious. The lines are really long, and you don't really know what to expect. I had a friend who was waiting in line for 4 hours, and so it definitely is like a very like exhausting experience from what I've heard. But that's pretty much what I've heard so far, other than people being, a little scared because so many people are getting it. So many people are getting COVID.
Thank you, Melly, for your input. I appreciate it. I want to ask this of Darielle. How can we create more resources for young people?
That's such a good question. And Sage, I just want to make sure I'm following along as it relates to access to the vaccine or
access to the vaccine, and if needed, unnecessary aftercare.
Unnecessary aftercare, yeah. such a good question. I really think it's just all about collaboration with providers. And I think it's so important. And I think in my work that I do now, it's so important not to work in silos. And I feel like sharing those resources with other providers is so important. Voicing what we heard about what's coming down the pipeline or what's upcoming is so important too as well. And one of the things that we've done at my friend's place is we now have on Tuesdays, people can come and get vaccinated. You can come and get vaccinated. I mean, not vaccinated, I'm sorry, COVID tested. And that has been huge. That has been so helpful because as part of the housing process, we've seen that a lot of the providers were requiring people to get tested. And so now that we have that resource on site, it creates access. And I don't know if that's something that can be possible for vaccinations, but I think that for other providers, but I think that it's so huge and really important to be able to provide that resource in order to increase that accessibility to vaccines. So collaboration and just really having that conversations with other providers is huge and huge for me, I think.
Thank you, Dario. I'm going to ask the same question to Jeffrey. How can we create more resources for young people?
I would say networking with the local community. As I stated earlier, it was the local Walgreens manager that coordinated coming over here. So it was that relationship that we had with the local, store, pharmacy down the way. So I think getting out there, letting people know who you are and that we do have, vulnerable youth out here that could use not just vaccines, but information about COVID-19 and inviting people in over Zoom to talk about it. This conversation is very helpful for me, and I think it would be for a lot of our youth to get experts' opinions from Dr. J. Lee and from Dario. You guys have been great, but I think the diverse diversity of information, right? So you can hear from multiple sources. When someone was talking about listening to the news, it was in the first video you showed. They said they don't watch one news channel, they watch 3 different news channels and kind of figure out and take what they want from each one to find their truth. So I think similarly, we got to have diverse people at the table to have that conversation so that we can, collectively, inform our youth.
Thank you, Jeffrey. Dr. J. Lee, same question for you. In what ways can we create more resources for young people?
Yeah, so thanks again, Sage. And again, I really appreciate this conversation we're having. And I also appreciate Jeffrey and Daryl, your comments. I think what is important, so I totally agree this cross-agency collaboration is really key. But I also want to kind of challenge all of us and say that we really need more funding for, agencies like Covenant House, Safe Place for Youth, and LA LGBT Center to really support our youth. And, I think, COVID-19 vaccination, we can also use it as an opportunity to frame this as, working with youth to promote overall wellness. And, Jeffrey, your comment about, relying on folks that went through the vaccination and then have them share their real experiences about, what it is like to get vaccinated, I think that's key because I think they trust their peers. And also at the same time, if the vaccination is multiple doses like Pfizer and Moderna, I think it's important for us to really understand how difficult it is to make sure that youth come back for the second dose and have enough funding to provide transportation, for example, appointment reminders to make it as easy as possible for young people to get fully vaccinated. And, I think in terms of potential side effects, it is also important to really intentionally think about maybe providing a temporary housing when they have severe side effects, because that might be a motivation not to get vaccinated because they're afraid of having severe side effects. And then the other thing is, you know, when we get vaccinated, from as far as I know, we have that 15 minutes after vaccination that people have to wait to make sure that they're okay. I think those 15 minutes are really valuable in terms of, you know, working with youth to provide like needs assessment, provide any kind of referral services for example, mental health. So I think we can kind of see it as opportunities, but to make that happen, we really have to push our government and, you know, funding agencies to really, you know, advocate for more funding for all this wonderful work that you all are doing.
Thank you, Dr. J. Lee. I'm so glad that you mentioned the temporary housing aspect, because that was one of the things that I was thinking of in terms of, okay, there's a process of getting the vaccinations, but also what about necessary aftercare if someone does seem to show side effects that are very unwarranted or unwanted and they can't really recuperate immediately from within that 15-minute window. So thank you for highlighting that. Thank you for highlighting that. Okay. And my last question, Hunter, I'm going to start with you. What can help guide discussion? Hunter, you are a peer support specialist, so you are a direct face-to-face resource for the young people that you see at your job, the LA LGBT Center. What are some of the ways that you think can help guide discussion? And then what are some more innovative ways that we can guide discussion further along the COVID-19 livelihood that we're in now?
Definitely have more resources like this where we speak to an actual professional to answer any questions or concerns we may have would be great, because a lot of our people that we serve don't have access to healthcare at all, and a lot of them are don't want to be misinformed, and so I think that would be something that we should do.
Thank you, Hunter. Melly, I'm going to ask you the same question. What can help guide discussion?
I definitely think that the best way to guide a discussion about things like this, and honestly, like any topic that becomes like political or controversial, is to like reassure people that you respect where they're coming from and that you respect their opinions. You don't ever want to make anybody feel like you're necessarily debunking how they feel, because like I said before, everybody comes from different point of views, everybody comes from like different experiences, and those experiences like develop your opinion and it develop how you feel about things. So I think the easiest way to like, you know, guiding a discussion and keeping somebody's attention during the discussion is to like just make them feel like they're comfortable and they're, you know, they're able to like speak and they're able to say, you know, how they feel, and they're able to like, you know, state like where they're coming from.
Thank you, Melly. And Darielle, I am going to end on you with the same question. What can help guide further and future discussions?
Yeah, I just want to thank you, Hunter and Melly, for sharing that. And I share very similar sentiments. And I think that just going back to being able to sit with the hesitancy is super important. And I think just really acknowledging how this is a difficult time for all of us, and we're making these really hard decisions. And there's so much that goes into that it's influenced, and how we decide something, very similar to what Millie said. And I think that's part of that discussion. That's part of sitting with that and acknowledging that all of that. So that's kind of how I feel about it.
Thank you, Darielle. Panelists, is there anything, we have 2 minutes left on our clock. Is there anything that I may not have brought up that you feel the need to get out right now? Please say it now, forever hold your peace.
I do. I just want to share something that I just thought about right now. So I have 28 youth out here that just got vaccinated with the Johnson & Johnson vaccine, and they're having some side effects. You know, there's some sniffles, body aches. And I was thinking, who's giving them the soup, right? You know how when we're sick, we have a family member that's making chicken soup. So I'm gonna go make some soup right now and make sure they get some.
Thank you, Jeffrey. I know they're going to appreciate it, especially because the
I
clouds
know
have
I need
been.
some too. I'm definitely doing that.
Thank you, because it's definitely overcast. I thought it said the rain was going to clear. Clearly, it hasn't. So, thank you for that. That means the world to them.
Yeah, thank you guys. This was great.
Thank you.
Yes, Sage.
Yes, Tony?
If I could ask a question just in general for everyone. So to what Melly said, you know, we all have our own information. So as people who are relaying information to young people at our different organization, how do we make sure our own personal bias isn't, you know, coercing anyone into taking it? But I also get that, you know, telling someone, hey, I'm okay and I got it, you know, might be a good example to, you know, tell someone, hey, you know, someone you know got it. But how do we also make sure that we're not using our own personal bias, you know, to coerce anyone into getting the vaccine?
Great question, Tony. We can take 2 panelists' input on that.
I think that like at the end of the day that another important thing to like remember is that although everybody has their opinions and although everybody is experiencing a different like perspective, not everybody reacts the same. And so it's important to not like sort of force people and be like, well, it went well for me, so it's gonna go well for you, type of thing. So I think that as long as you're not like trying to like convince or kind of like trying to like sway or force anybody into doing anything, that it's, you know, it's still like it's great. Because I have run into a lot of people, they've told me like, well, you know, I know these facts and so you should do this. And it's like, you know, at the end of the day, people are a lot more comfortable when you don't try to like force them to do things. You don't try to like overwhelm them with facts. Because it can be really exhausting when you like overwhelm someone with a lot of facts, you know, and you like try to tell them like, you know, this is what's the truth and what you feel is just an opinion. You know, that can, you know, discourage a lot of people, make them feel very uncomfortable. So I think it's important to like, you know, understand that even though there are things that are, you know, true, solid facts, it's still like important to give people the space to make their own decisions. Because at the end of the day, you know, that's their body and that's their decision.
Thank you, Melly. And unfortunately, we don't have time to get to the last panelist because we want to move into our call to action. So I would like to thank all of our panelists we had today, Melly Flores and Hunter Pixel of the Youth Expert Board, Dr. Jay Lee from the Department of Psychiatry and Biobehavioral Sciences at UCLA, Jeffrey Richardson at Covenant House, and Darielle Crawford from My Friend's Place. Thank you very much. Now we'll move into the last part of our town hall.
All right. Thank you so much, panelists. Robin and Laura, should we talk about the call to action now?
Yeah, Robin, are you able to share your screen?
Y'all can see, right?
Yeah, we have it up.
Yes.
Yeah, so the main call to action, I guess, is just spreading the word about our youth expert board. We are looking for new members, and I do have a description of the membership. So you guys can definitely either reach out to me, Laura, Robin, and we can send it out to you if you're interested in applying. And also buy a Zine from My Friend's Place. I definitely want to get that copy of that book. That's amazing. I love that you guys are doing that. But yeah, any last thoughts, Laura, Robin?
Thank you all for being here. I wonder if this has been such a great panel. I learned so much. Maybe we can do a final checkout question for everyone on the youth board. Does that sound good? Share maybe one thing that we learned today that was really great to learn. I'll start and say I was really excited to be on this panel or to do this event with you all. I'm just like I think it's really cool that Walgreens just decided to bring over some vaccines to Covenant House, and that was because of the community relationships that were built. That was a really awesome resource and like just beautiful community connection that I learned about. Who's next?
I can go. I'm feel like I learned a lot in this, like with the panel, also Dr. Rice sharing things about work previously and how that could relate to the future. So I think I'm still processing quite a lot, but I really loved hearing from all of our panelists, and I feel like I'm still like kind of working through some of those things. And I just want to give a shout out to Sage for moderating. Thank you so much for doing that. I know you were excited for that role, and it was awesome.
One of the things that I learned, actually coming, something Melly said that I don't think a lot of us have been, well, I myself haven't been practicing, is respecting other people's opinion. Because, even though someone may have the wrong facts about something, like you still have to respect where they're coming from and, their opinion and what they know. So it's definitely an approach that I haven't been doing and I plan to start using.
Thank you, Tony. This is Sage. Something I learned today was that although we all come from various, the term silo was used earlier. Some are service providers, some are youth expert board members, some are professionals within institutions. But out of all of that, we all have overlapping basis and truths regarding the vaccine, as well as differences that I didn't take as detrimental in terms of getting this information out to people. So that's what I like today. We all have differences, but we also want to get down to the truth and get life back to some type of normalcy.
Yeah.
Ellie, do you want to go?
Yeah. Well, I guess something that I learned today was it was pretty great hearing that Walgreens got involved like that with the community, because it's not something that I personally see very often. So that was like something really great to learn about. And then seeing that, that people care, it's like also like it's really great. It's very like reassuring.
Thanks, Melly.
Oh,
go ahead.
Just a quick question for Jeffrey. Is Walgreens still offering youth vaccines, or it was just a one-time thing?
I think Jeffrey isn't a speaker right now, so we'll see if there's a response in the chat, and we can make sure to loop back to you, Tony, so that folks know.
Hunter and Travis, do you have any final thoughts?
Everyone kind of said it, but I thought it was super cool that Walgreens did it. Hopefully, others can lead by example, so then members can have way more accessibility than before.
And Travis, you want to close this out?
Yeah, I just want to thank everyone so much. It was great to see all these familiar faces and hear all this great research and these great discussions. Thank you all so much for coming here. I'm sorry, I know I'm in the train station. I'm on my way to work. But thank you so much for coming to the LACEYH Town Hall, and cheers to our next one.
Cheers. Thank you, everyone. Have a lovely day.
Thank you, everyone. We'll send out something at the end so that folks can get linked, and we'll see you all at a later time.
Bye.
Have a good weekend.
Yay.
Thanks, y'all.